So there's a way of breastfeeding which is known as the exclusive breastfeeding, okay? But you can also call that exclusive breastfeeding as a type of breastfeeding that breastfeeding is the only form of nutrition to the infant, okay? So there are benefits of this at least within 6 months of life. If a mother is practicing this, she's breastfeeding the baby strictly on breast milk within the first 6 months of life. There are so much advantages of this, of course, to the baby and also to the mother. So exclusive breastfeeding, that's a proper way to call it, is usually done for the first 6 months of life, okay? Some people might actually want to do it more, or at least some people might start introducing water after then. So it provides complete nutrition. That one is just a summary. I don't like the summary. Let's look at the in-depth lecture. So on the nutrition and developmental benefits, that's like benefits to the baby, it provides complete nutrition. Breast milk has all the balance of every how will I say it, every fats, proteins, carbohydrates, vitamins that you need. So dynamic composition, so nutrients adapt to meet the changing needs of the baby as they grow. Then digestibility is easier to digest. So when you're feeding your baby all the solid food, the baby might actually develop diarrhea or constipation, depends. But with breast milk, it's very easy to digest. Then on the immune system, that's still on the baby. It gives the baby antibodies rather, okay, that can fight infections. There's lower risk of illness because breast milk is just coming out. Once it is pure, then there's no problem. Long-term health, okay, lower the risk of even conditions that the baby will have later on in life, okay. The emotional and psychological benefits, that's mother and baby now, promotes bonding, okay. They are always communicating with these humans, so you guys just have to like each other. Comfort and security, okay. Of course, you have seen people talk very good about breastfeeding, okay. So you know that once I'm following this path, I'm not off. Do you understand? Then for the mother, postpartum recovery, it has a way of trying to bring back the uterus to how it used to be. Natural contraception, if the mother is breastfeeding back to back, it will stop further pregnancy, okay. Let's reduce cancer risk. So there's one risk factor for cancer, breast cancer, that most women are nulliparous. That means they have never breastfed in their life, have never been pregnant, so they have never breastfed. So there's a high risk for cancer and ovarian, that's breast cancer and ovarian cancers. So it's cost effective. Breast milk is not something you buy from yourself, right? It's safe and hygienic. It's environmental friendly. So breast milk, there's no packaging stores that you have to deal with and be disposing anyhow and all of that. So that's what we got here for benefits of breastfeeding. It has the only form of nutrition in infants.